Thank you. It's great to be here this morning. I really very much want to thank the Latino Commission on AIDS and the Hispanic Federation for sponsoring this briefing today. And I also want to give a special shout out to a couple of representatives who have really provided extraordinary leadership. Representatives Lucille Roybal-Allard and Nydia Velasquez for really hosting this event and helping us make it happen. We appreciate your support and very much are glad to be able to be here today for the 2009 National Latino AIDS Awareness Day Congressional Briefing. And I want to thank Francisco Ruiz and Gary Jenkins, my fabulous staff, for being here. They are the ones really who are leading the work that NASTAD is doing in this area. I'm afraid I get to be here to share not particularly happy news, and so I'm going to get right to it. But what I'm here to talk about today are findings of a survey that we've done on the impact of state budget cuts across the country on HIV/AIDS and viral hepatitis programs. And I think it's going to be, hopefully, a wake-up call for all of us that we've got a lot of work to do. So NASTAD, just to back up for a minute, represents the nation's chief state health agency staff across the country in all of the states, the District of Columbia, the territories, Puerto Rico. These are the folks who manage the continuum of HIV/AIDS and viral hepatitis programs. So prevention, care, treatment, surveillance, hepatitis. And we here at NASTAD provide technical assistance to our members to help them do a better job and obviously also do a lot of advocacy for the resources they need to get that job done. We have at NASTAD prioritized addressing racial and ethnic health disparities since the 90s and have done that by creating a Latino advisory committee where we've had folks from across the country giving us advice on how we can assist health departments in doing a better job reaching out to Latino communities. We also are a participant in the National Latino AIDS Action Network. In 2008, our organization released a call to action entitled Adelante, Strengthening the Response to HIV/AIDS and Viral Hepatitis in Latino Communities. This is available in both English and Spanish. I don't know that we have it here, but you can certainly get it on our website. And this call to action urges health departments, national organizations, community-based organizations, and particularly elected officials at the federal, state, and local level to really scale up efforts to fight HIV/AIDS and viral hepatitis in Latino communities. And in this call to action, we in particular try to focus in on specific recommendations for very specific subpopulations within Latino communities. I think we all recognize there are very many challenges because there are so many varied communities that need our assistance. And in particular, we are focusing an increasing amount of attention on the needs of Latino gay men and other men who have sex with men because we know they bear a significant and disproportionate burden of new HIV/AIDS cases. This year, we're continuing that focused work and releasing a Spanish-language version of our youth issue brief entitled HIV/AIDS Crisis Among Young Black and Latino Gay Men and Other MSM. It again really calls on all of us to focus in on how we can do a better job reaching youth in particular and Black and Latino youth specifically around HIV and AIDS. So what I'm really here to talk about are the unique role of state health departments and local health departments in addressing the HIV/AIDS epidemic. I think when we are all here inside the Beltway and here in the Capitol, we really focus an awful lot on the federal response. And I want to paint a little bit of a broader picture today and really provide some information that I think is an even greater call to action because when we look out across the country, I have to say that our public health system is in crisis, it is crumbling, and we all need to, I think, wake up in this moment, particularly as we're debating healthcare reform, and try to pay attention to it. State health departments are entrusted by U.S. law as the central authorities for the nation's public health system. And as such, they bear the primary public sector responsibility for public health. What does that mean? Well, it means that health departments have responsibility for protecting all the citizens that reside within their boundaries. It means that they're responsible for pulling all the pieces together and developing a comprehensive system of care, prevention, and support for people living with HIV and viral hepatitis. They have to make all the pieces fit together. So they take the federal pieces, the state and local pieces, the community, all of the resources that can be brought to bear to address these public health challenges and make sense of them when the rubber meets the road out in the field.